Getting the best results from your orthodontic treatment. Caring for yourself and your braces.
Well, that wraps things up for now. Let me introduce you to Debbie, who'll show you how to take care of your teeth and braces. Debbie?
Thank you, Doctor. Hi, Mrs. Carlson.
Call me Peggy.
Hi, Peggy. Well, like the doctor just said, I'm going to show you how to take care of your braces, and I'll give you 8 steps to a healthy and beautiful smile. Now, the 8 steps we'll talk about today are things like brushing, flossing, using mouth rinses, using oral hygiene aids like an interproximal brush and floss threader, checking to be sure everything's clean, foods to enjoy and foods to avoid, keeping appointments and seeing your general dentist regularly. Adults usually do a great job of keeping everything clean and eating properly. And a balanced diet is important for keeping your teeth and gums healthy and for your overall physical health. Now, your goal when cleaning your teeth and gums is to remove as much plaque and food debris as possible, because an accumulation of these is what leads to tooth decay and gum disease. Now, I want you to do a thorough job every time you brush, and I want you to use a soft toothbrush and fluoride toothpaste. Also, make sure your toothbrush is in good condition. A worn-out toothbrush won't do an effective job. Now let me show you how I want you to brush.
The basics of brushing with braces are similar to brushing without braces, but with some important differences. Your orthodontist and staff will give you specific brushing instructions. Make sure you understand and follow their directions.
There are many different types of braces. Some have clips to hold the arch wires in, while others use an elastic O-ring. Now, on your braces, the tooth is actually protected where the bracket covers the enamel. Now, where it's not protected is around the bracket in front, on the back, on the chewing surfaces, and on the sides between the teeth. It's not protected under the gums either. So when you brush, you need to be very careful to reach all of the tooth surfaces and to brush above and below the brackets to reach all parts of the tooth. Let me show you.
When brushing with braces, begin by brushing your tongue and the chewing surfaces of your teeth. Then, starting at the back left cheek side of the top row, carefully brush your teeth by holding your brush at a 45-degree angle and make small circular motions to clean the tooth surface and gum. This motion should be more like massaging than scrubbing. Flex the toothbrush bristles to go underneath the wire and stroke away from the brackets, following the direction the tooth grows. Next, angle the toothbrush downward and using the same circular motions, brush the top of the bracket, paying special attention to the area between the bracket and the gum. In this manner, carefully work your way all the way around the upper arch. Be sure to brush the back side of the rearmost teeth using the same circular motion. Brush the same way on the bottom, carefully brushing below and above each bracket, carefully pushing the bristles under the wire as you work your way around. When finished, once again, brush the backs of the rearmost teeth using the same circular motions.
Now, after you brush, be sure to rinse thoroughly and check in the mirror to make sure you've gotten everything as clean as can be. You may find you need to brush again if there are some areas that you've missed. A good way to tell if you're brushing correctly is if your braces look clean and shiny and you can see the edges of the brackets clearly. This is a good time to check for loose or broken brackets. If you find a problem, call the orthodontist's office to see if it needs to be checked out and if extra time needs to be scheduled to make the repair. If your braces start to look sort of dull and fuzzy, this may be a clue that you need to do a better job. Also, if you're doing a good job cleaning your teeth and gums, your gums will stay healthy and firm. It's easier and less expensive to prevent gum disease and tooth decay than it is to treat it after it develops. So if your gums become red, swollen, or start to bleed when you brush, that's your body telling you there's plaque underneath the gums and that you're not brushing and flossing well enough. And if the plaque isn't removed, over time you could develop gum disease, which is a bacterial infection. Early gum disease is reversible with professional help and good home care, but if you ignore it, it can get worse. Your gums could swell enough to cover your brackets, and that's very unhealthy, not to mention unattractive. Gum disease usually doesn't hurt, so you need to pay attention to signs like bleeding when you brush or swollen and puffy gums. And you'll be needing the travel toothbrush, a small toothbrush that fits in your briefcase or purse. You can buy them at grocery stores, drug stores, or large discount stores. And you need to carry that with you so you can use it at work after lunch. And just add toothpaste like this travel tube.
Neat. But I can tell you right now, I'm not always going to have time to brush when I'm at work.
Well, I understand, but you need to make the effort. Even if you can't use toothpaste, brushing with water at least clears out some of the food and plaque from your teeth and braces. And if you can't do that, at least rinse your mouth thoroughly with warm water. Now, here's something else you're going to need: dental floss. Brushing alone won't reach all of the plaque and debris between your teeth. That's why flossing is a crucial part of your daily routine. So if flossing isn't already a habit, it's one you need to develop when you wear braces. And it's a good habit to hang on to when your braces are removed. There are several kinds of floss on the market. Just kind of experiment to see what works best for you. You can buy pre-threaded floss or use a floss threader and regular floss. A floss threader makes it easy for you to get the floss between your teeth and wires. Just cut off about 18 inches of floss and loop it through the threader, like so. Then run the threader underneath the arch wire of your braces, between two brackets. Hold one end of the floss, and you're ready to start flossing.
With the floss in place, simply form a letter C around the tooth. Then slide the floss up under the gum and gently clean the side of each tooth with an up and down motion, easing the floss up under the gum line and pulling it back down toward the wire. Repeat this motion 4 or 5 times. After that, floss the neighboring tooth in the same way before pulling the floss out and using your threader to start again between the next 2 teeth.
Flossing is one of the most important parts of taking care of your teeth, especially when you're wearing braces. It might be a little cumbersome at first, but with practice it really will go much faster. You might want to make it part of your routine just before you go to bed. That way you'll have plenty of time to do a thorough job. Now, here's something else to help you clean: an inner proximal brush. It's designed to reach between your wires and brackets and between your teeth and grab the plaque and debris that get trapped there. Inner proximal brushes come with a couple of different brush tips, a cylinder shape and a cone shape. They also come with a long handle for home use or a shorter travel size handle. Try different ones to see what works best for you. You can buy these in the oral hygiene department at most drugstores or large discount stores. Now, use your inner proximal brush at least once a day, and you might even find yourself using it more often. And remember, this is in addition to flossing.
Other products your orthodontic team may recommend include a water irrigator, an antibacterial mouthwash, or a fluoride rinse to keep your tooth enamel strong and stain-free. Your team may also recommend a power toothbrush. The brushing technique is the same as with a regular toothbrush, or plaque-disclosing tablets that can show you the spots you might have missed when brushing and flossing.
Now, let's talk a little bit about food. With braces, you'll need to be careful about what you eat. A healthy, balanced diet is essential during orthodontic treatment. Your body needs nutrients to keep your mouth healthy during treatment. Early on and after adjustments, you may want to stay with softer things like soups, stews, and casseroles, and so on. You should include things like fresh fruits and vegetables, but you need to cut them into bite-sized pieces instead of biting into them. And instead of biting into sandwiches, try cutting them up or tearing them into bite-sized pieces. But you are going to have to stay away from sticky or really chewy foods like caramels and taffies and things like that. And you'll need to stay away from anything that's crunchy or hard. Things like bagels or chewy breads, whole apples, whole carrots. I mean, you can have these things, but cut them into small pieces. Now, avoid corn on the cob, hard taco shells, hard pretzels, hard chips, nuts, or ice. Chewing on ice is damaging to teeth, and it's worse when you're wearing braces. Ice is hard, and with enough pressure, you could actually break a tooth. And when you're wearing braces, chewing ice can knock off a bracket or break a wire, which means they can't move your teeth, and that might mean you need to wear your braces longer than you anticipated. Also, it's a good idea to limit or stay away from soda pop. The bacteria in your mouth form acids from the sugar in the soda pop, and these acids can weaken tooth enamel and cause tooth decay. Even the popular energy and athletic drinks contain lots of sugar and may contribute to tooth decay. Things like red wine, coffee, soda pop, mustard, and tomato sauce can stain the rubber O-rings if your braces are using them. Some people tend to chew their pencils or pens, sometimes without even being aware that they're doing it. This can bend an arch wire or loosen a bracket as well. The same thing goes for people who bite their fingernails. You know, really, it's just a matter of being careful and thinking before you bite down. And here, you need to take this along too. It's orthodontic wax. If you have any spots that are irritated by a bracket or a wire that's poking, just put a small piece over that spot. You can find these in the oral hygiene department at the drugstore or the discount store.
Remember, as an active partner in your orthodontic treatment, your actions have a direct effect on the results you achieve. To get the most from your treatment, be sure to follow these 8 steps to a healthy, beautiful smile. 1. Brush after every meal and before bed and rinse thoroughly. 2. Floss at least once a day. 3. Use a fluoride rinse if your orthodontist recommends it. 4. Use any other special products your orthodontist recommends, such as an interproximal brush. 5. Carefully check to make sure you've removed all the food and plaque from your braces, teeth, and gums. 6. Eat a healthy, balanced diet and stay away from foods or drinks that can weaken the tooth enamel or damage your brackets and wires. 7. Keep all of your scheduled orthodontist appointments. And 8. See your dentist every 6 months, or more often if recommended, for your regular checkup and cleaning.